In this section, I'm going to introduce members of the phylum Nematoda. So we have now entered the realm of animals. These are going to be macroscopic, multicellular, eukaryotic pathogens. Nematodes are often large and cylindrical. That cylinder shape is why they are sometimes also called roundworms. Unlike typical worms like earthworms that we think of, which are annelids and belong to a completely different group, our nematodes are unsegmented. We will also see some of our tapeworms have segments, but these are quite smooth with no segments. The adult worms are often found in the intestines. There are lots of roundworm infections. Many of them do infect humans. We are going to talk about some of them, but not all. Unfortunately, we just don't have time to cover everything. But some of them also infect animals. So dog heartworm belongs to this group. Raccoon ascaris belongs to this group. And what can happen is sometimes these worms that actually belong in animals, like Raccoon ascaris, some of our hookworms, our portworms, when they get into people, they can cause really significant issues. And so if you ever watch any of those shows like House, or there's one called The Monsters Inside Me, specifically, I'm thinking of this one, the Raccoon ascaris. There are, in each of those shows, there's an episode about these worms. So again, unfortunately, we don't have the opportunity to talk about all of these worms. We're going to talk about the ones that you would most likely see in the United States, even though some of them do really cool things. For example, Bancroft filaria causes basically a type of elephantiasis where the worms get in the bloodstream and block circulation to such an extent that the patient's leg will swell up and looks like an elephant leg, excuse me. So some of these are very, very wicked infections. But again, we'll talk about the ones that are most common in people in the US, though things like Raccoon ascaris can be acquired in the US. The first infection we'll talk about is gross. It's pinworm, Enterobius vermicularis. Pinworm is a fecal-oral parasite. It is transmitted person to person and often can spread through daycares, schools, and mental institutions. It's estimated that there are anywhere from 500 million plus cases per year worldwide. So again, fecal-oral infection, and it is possible to have auto-infection. You basically continue to reinfect yourself. So what we see are eggs in the perianal region. That's the diagnostic stage. The eggs are ingested, and that's the infective stage. So the eggs are infective within hours after being laid. The eggs will hatch in the small intestine. The larvae will molt into the large intestine, and they'll kind of hang out in that mucosal area where they will mature. Because these are roundworms, we do have female and male worms that are found in the lumen of the cecum. Remember, the females are often larger. The gravid female, the female ready to lay eggs, will migrate to the perianal region at night where she will lay her eggs. So this is one of those that diagnostics is a little bit easier if you know what time of day to look for things. Generally, what will happen is that patients can be allergic to the worm secretions, or they can kind of feel it. So you'll have some scratching around the anal region. The allergy can lead to loss of sleep and severe itching, and scratching can lead to secondary bacterial infection. You'll notice that I said some of the areas where these are most common are going to be places like daycares and schools. I like kids, really I do, but they're dirty, and they really don't have a whole lot of self-control. So if they have a perianal itch, they're going to scratch it. And after they scratch it, they may not have washing their hands as a priority. So that's how this can spread. If the eggs get on something that somebody touched, and then that gets in somebody's mouth, but that's also how we can get auto-infection. It is not common, but the worms can migrate to the vagina, to the urethra, especially in females because of the anatomy. It's a little bit more difficult for them to migrate to the penis because it's so much farther away. And you can have inflammation or granuloma formation in the bowel, but that's not, again, a common manifestation of infection. Generally, the way that we will treat a pinworm infection is through albendazole or mebendazole of the entire family, because let's be real, if your 3-year-old has it, your whole house probably has it too, because that's just the way kids are. Relatively easy to diagnose. You will find eggs in a sticky swab of the infected area. Sometimes what physicians will recommend is literally just taking a piece of tape to the perianal region, putting it there at night, and then when the worms come out and lay their eggs in the morning, you'll be able to see the eggs on the tape. You may or may not even capture one of the worms on there. So that's a lovely image. Really, in order to prevent infection, it's increased personal hygiene. If you are going to scratch your perianal region, you should immediately wash your hands with soap and water. I'm sure as adults we all know that, but if you're around children, make sure that they're frequently washing their hands as well. The next nematode infection is a scaris infection. This is a really dangerous parasitic infection. These worms cause really severe disease. They can lay up to 200,000 eggs per day for up to a year. And the scary thing about these eggs is that they can remain infectious in the soil, but they're infectious approximately 2 weeks or so after they have been deposited in the soil. So if we look at the life cycle, let's start at the beginning. So we have eggs that are found in the feces. The eggs will continue to divide from a 2-cell stage to a more advanced embryonated stage. And at this point, after 10 to 14 days in the external environment, if the egg is ingested, this is considered to be the infective stage because you have the larvae inside. The larvae will enter circulation. They will go to the liver. They can go to the lungs. They will spend approximately like 10 to 14 days in the lungs. And then generally what will happen is the coughing will bring the worms up, and they can be swallowed and go into the small intestine, or they can burrow there if they want. Remember, we do have larger females and smaller males. These are not hermaphroditic. And from the time of ingestion to the time of egg production, we're looking at 2.5 months. And then they're going to be passing eggs. This is found in areas with poor sanitation and any areas that may use human feces as a fertilizer. Sometimes this is called night soil. This is not terribly common in areas of the world with access to regular fertilizer, but in other parts of the world, it is possible to see human feces being used as fertilizer. This is the most common helminth infection worldwide, estimated to infect or affect approximately 1 billion people. In general, patients normally would ingest the larval stage, right? They ingest the embryonated egg. Ingestion of an adult can be very dangerous. They can migrate into the bile duct and into the liver. They can perforate the intestines and cause infection in the peritoneal region. Having this infection can also lead to death because of blockage of the intestines. And so this image that I'm showing you down here is from a patient, from the autopsy of an infant. That is the mass of roundworms that were pulled from the infant's stomach. Examination of the stool will show eggs. Occasionally adult worms can be shed in the feces as well. Treatment is going to be similar to that you would do for pinworm. And eggs can persist in the soil for up to 3 years. I'm not sure why the word day is there. Disregard. It should be 3 years. Next, we have Trichinella spiralis. This causes a disease called trichinellosis. This is a pork worm. This is not pork tapeworm. This is pork roundworm. The adult worm lives inside of the intestinal mucosa. And of course, again, you've got the larger female, the smaller male. The adults release larvae. The larvae will go into muscles and form cysts. So in striated muscles, you can find the infectious larval form. And that can be extraocular muscles, tongue, deltoid, pectoral, diaphragm, calf muscles, in muscles, right? So generally what's happening, this can be like only in the pig, right? So one pig can infect another pig. A pig can infect a different carnivore. At some point, a pig or another animal will ingest meat that contains the worm that has encysted, the larval form that has encysted. It will be released in the small intestine where they'll mature into adults. The larvae will go into circulation and deposit themselves in muscles. Now, in humans, we tend to not be eaten, so we are kind of a dead-end host. But the same thing can happen if we ingest contaminated meat and the larval form are released into our small intestines where they can mature into adults who will release more larvae. Those can encysted in our muscles. And so the diagnostic stage is going to be something like this, a tissue biopsy that will show roundworm larvae in muscles. This infection is found worldwide, mainly associated with the consumption of pork. In the US, it's estimated that there are 1.5 million cases, with an additional 150 to 300,000 patients acquiring the infection every year. Usually, most people won't have any symptoms. If they have fewer than 10 larvae per gram of muscle tissue, a patient will be asymptomatic. More than 100 larvae per gram of tissue will lead to disease symptoms, which can include muscle pain. Depends on which muscle the larvae have encysted in. If you have more than 1,000 larvae per gram of tissue, that can lead to death of the host. So lethal infections will occur with a combination of myocarditis, encephalitis, pneumonitis. If they get into the diaphragm and you start to have disease symptoms, that can definitely lead to death. So the heart or the diaphragm are really dangerous muscles for these to encysted in. Diagnosis is generally going to be through clinical observation, particularly during known outbreak situations. This can also be diagnosed through muscle biopsy. You're looking for cysts, of course, but also eosinophilia. So eosinophils will infiltrate areas that have parasitic infections. Treatment of Trichinella infection is difficult. You can eliminate the adults in the intestine, but most antiparasitics don't work against the larval stage. So once the larvae have encysted in the muscles, it can be very difficult to get rid of them, short of actually doing a biopsy and removing the cysts. Steroids can be helpful to eliminate severe infection. And of course, prevention would just be through not consuming undercooked pork. So cook your pork thoroughly. Next, we'll talk about hookworms. These are more commonly thought of as pathogens in our pets, but they can infect us too. There are a couple of different hookworms, the old world hookworm and the new world hookworm. They have these kind of like biting mouth parts that help them to burrow and attach. Generally what will happen is in the body of the host, the feces containing eggs will be deposited in feces. So say we're talking about your dog. Your dog has a hookworm infection. It is going to shed eggs in its feces. In the soil, the egg will continue to mature and it will eventually hatch into a larval form. The larval form will directly penetrate into the skin of the new host using its biting mouth parts. It will then enter circulation where it will move to the lungs, up the trachea, the pharynx, and eventually be swallowed. The adults will use those biting mouth parts to attach to the small intestine. Again, we've got a female and a male worm because these are not hermaphroditic. They will continue to lay eggs, which will be passed in the feces, etc. Infections are found worldwide. It's estimated that approximately 700,000 people will get a hookworm infection every year in the U.S. And again, this is most often associated with encountering animal feces. The worms in us, we are usually a dead-end host. Most of the time, the worms can't get to where they want to go inside of us. So generally it's a dead-end thing. And so what you're seeing here is a patient who had a hookworm infection where the worm kind of got lost in the feet, and you can see the tracks where the worm was. You see this inflammation and rash. This is a time course of a different person and their foot, and you can see how eventually you get the bruising caused by the movement of the worm. They can migrate to the lungs or GI tract, but again, it's not terribly common. And in some patients, if they do have a severe infection, they can develop anemia from the worm actually feeding. Eggs can be found in feces. This is what they look like. Again, our recommended treatments are the albendazole or the mebendazole to get rid of the adult worms. Blood transfusions can be useful in any of our patients who may have developed symptoms of anemia, but again, that's not terribly common. Proper hygiene, sanitation, wearing of shoes, treating of your pets can all serve as preventatives. And so I saw this headline a couple years ago, a teen infested with hookworms after a trip to the beach. I thought that was pretty disgusting, so I thought I'd share it with you too. All right, I'm going to show you one roundworm infection that we don't commonly see in the U.S., but only because it grosses me out so much, and I thought you might appreciate that too. So I'm going to show you Loa Loa. Loa Loa is transmitted by the bite of an arthropod, mosquitoes generally. So the mosquito will bite, and a larval stage will enter the body. It will travel through the lymphatic system. The adults will be in the lymphatic system, and they will release like a larval stage called a microfilaria. It's not exactly a larva, but kind of like a larva. And those will be in circulation. They'll be in the blood. You can be bitten by another insect who will pick up the microfilaria, which will mature inside of the mosquito and continue the life cycle. So this takes about 6 months from the time of the first bite to the time that we're producing these microfilaria. The adults can migrate through tissues in the body. The reason I wanted to include it is because of how gross I thought this was, with the worm actually migrating in front of the eye. This infection is only found in Africa, and so you won't see it in North America. Monkeys tend to be the reservoir hosts, so primates, and it's transmitted by what are called mango flies, or a type of mosquito. Symptoms may not appear for more than a year after the bite because the worms are pretty slow growing. They cause swelling as the worms migrate through the body. It can be painful because you have the infiltration of eosinophils. It can be diagnosed through observation of worms and microfilaria in the blood. And some of our standard anti-helminths can reduce the load of the adults or even the microfilaria because these are not technically a larval stage. The larval stage occurs in the mosquito. The worms, when they get in the eye, have to be surgically removed. I can't imagine how terrifying that would be. But first they are immobilized, believe it or not, with a 10% cocaine solution. So a 10% cocaine solution paralyzes these worms so that they can be surgically removed from the eye.